Okay, you guys, so this is my TMI/embarrassing pregnancy symptoms video. I guess that's what we can call it. It's in regards to a question that I got asked actually twice, and I do apologize for not addressing it earlier. I honestly just forgot. Baby brain, which is one of the many symptoms of pregnancy. But this person did ask me again. I'm sorry I forgot what your name was, but if I can think of it, I will, or if I can find it in another one of in the other comment section where you asked this, I will try and link it below. Anyway, the question was, have I experienced any kind of, like, embarrassing pregnancy symptoms? And I did address having really bad constipation, which I guess you could call that embarrassing, but let me just give a disclaimer real quick that I don't really personally find a whole lot embarrassing in general to talk about. I mean, for those of you who've been following my channel for a while, even before I got pregnant this time around, I mean, my channel is full of very personal subjects, from a weight gain journey to something that I had to split up into two separate videos because it was such a broad spectrum topic, and I really didn't even cover everything there is to cover about the history of sex toys and masturbation, and how there is a lack of discussion about that among women. So there's really not much that I'm censored about. There's really not much that I'm embarrassed by. This is just from what other women have said they find really embarrassing. But I will state the thing that I found embarrassing the first time that I was pregnant was the lack of privacy that you get being pregnant and giving birth. Now, let me clarify on that. Primarily in the medical field. So, let's just be real here. Whether you're going to see an obstetrician or a midwife, all your business is going to be hanging out in front of whoever you choose for a care provider. They are going to be feeling all over your belly. They're going to be doing a breast exam. If you're 21 or over, they're going to do a pap smear. They're going to do, STD testing, all the regular stuff that you would get done at your OBGYN office or what have you on a regular basis, and then some. And then once you actually go into labor and you're ready to give birth, I mean, all of your business is hanging out. Like, in the office, it's just you and your doctor, or you and your midwife, and your support person, or your husband, boyfriend, partner, whatever, that's there with you. Just very personal little circle. In a hospital, it's very different. I mean, first of all, you're not in your clothes. You're in the hospital gown with those stupid looking socks on your feet. If you're lucky enough to get a pair of socks within the first hour of being there. They're like poking at you, prodding at you. There's somebody coming in every hour or two, sticking their hands up your hoo-ha, checking to see how dilated you are and this and that. After you give birth, there's somebody coming in about every 2 hours, literally looking down your underpants to see how much bleeding you're doing, having you turn on your side and like spreading your butt cheeks open to check and see if you have hemorrhoids. So it's a very personal... My mother just walked in the room and she's hearing me talk about this in such a candid manner. I just got done saying I don't get embarrassed, but here I am, like, Bob the Tomato red in the face. She walks in at the most priceless moments, but that's literally what happens. Like, because, and let me just go into this, hemorrhoids is a very common problem in pregnancy in general, because of constipation, actually. I thankfully have not had that problem, surprisingly, but especially during the actual delivery, like when you're actually pushing, because of all that force and pressure and trauma going to that area, it's very common to get hemorrhoids. So they'll check you regularly for it, and they're sitting there poking around back in there in places that you don't want to be poked and prodded and everything else. And I mean, then a lactation consultant's coming in your room, having you take your top down and playing with your boobs and showing you how to stick your boob in another human being's mouth properly. I mean, it's just all kinds of uncomfortable, just very exposing, uncomfortable things happening in a hospital delivery. Even in a birthing center delivery, you're still going to have everything hanging out. In certain cases, you can request not to be checked every couple hours to see how dilated you are. You know, some midwives are really cool with that, and they're like, you know, it's not necessary. You'll know when it's time, when you feel the urge to push. So, you know, in that case, you can get away with that. If you've breastfed before or anything of that nature, even if you haven't, you don't have to have a lactation consultant in the room showing you, but it does help. I will say that as awkward and embarrassing as it was to have another person just like grab my boob and show me how to put it in my son's mouth so he could nurse properly, it was a big help because we did have, he was eager to latch, but he just didn't have the proper latch, and I didn't know how to get him to properly latch on. So having her just show me that one thing and show me how to, you know, properly position him was a huge help. And from there we nursed for 3.5 years, no problems. With the occasional clogged milk duct being the exception. But other than that, you know, there's just not much you can do to get around that very exposing, very out there feeling. And up until that point, I was very conservative, very shy about my body and everything like that. And in that way, I found the whole birthing experience to be empowering in a sense, because it really stripped me of that, literally. Like it stripped me of any covering that I had to try to hide my body in like a shameful sense. Now, granted, I don't go out of the house with everything hanging out now, and I'm not going to join a nudist colony because I gave birth, but I feel so much more comfortable and at ease with my body because of how many people, both nurses, doctors, my sister, you know, just all these very supportive women that just let me know this is normal. Okay, you know, if you're laying there and you're pushing and you poop on the table, it's normal. We see this 10 times a day. Like, it's not a big deal. We're going to wipe it and keep going. You know, that's just, it's part of what happens. That is another embarrassing pregnancy / labor and delivery thing that can happen. People poop while they give birth, in case you didn't know. You poop, you pee, some people puke in the middle of it, like, all kinds of bodily things are happening, and it's very disrupting to your digestive system, and sometimes things just come out, and there's not much you can do to hold that back. Except for hope and pray that you did not have a heavy meal before you went into labor, and hope and pray that your bowels are nice and cleaned out before labor. Which usually, honestly, they do. A lot of women report that they have like a nasty case of diarrhea a day or two before they go into labor, and it's pretty much fairly well known among midwives and OBs that that's a pretty common symptom towards the end of pregnancy, that labor is imminent because your body is trying to clean itself out, flush itself out before the big day. So usually nature takes care of that. But if you wanted to, in, you know, the weeks leading up to labor and delivery, you may want to talk to your midwife or your doctor about, you know, is it safe for you to take a stool softener? So if you do have any constipation issues, you are able to, you know, eliminate all of that before delivery. Drink grape juice, drink prune juice, eat some pears, you know, there's a lot of natural remedies for constipation, and if you need something stronger, maybe even ask if you could take like some Miralax or something like that, because sometimes they let pregnant women take that if they have really extreme cases of constipation. But anyway, that's just another one of the gross things that can happen during labor and delivery or pregnancy, etc. But that was the only thing I found embarrassing, really, was just the exposure level that you're at. You're just in this very vulnerable, basically almost naked position on a bed in a room full of people that you don't know coming in and out, poking you, prodding you, looking between your legs, and in all kinds of uncomfortable places. Other than that, I mean, morning sickness I didn't find embarrassing per se. That's extremely common. Um, I mean, unless you're like throwing up profusely in front of a bunch of people and whatnot, that could be embarrassing. But for the most part, morning sickness didn't embarrass me. I mean, I'm trying to think. A lot of women report being very gassy during pregnancy, and I guess I can relate to that to a certain extent because I have noticed it slightly more this time around. But I just feel like with a person squishing my intestines, what do you expect? You know, they're squishing and they're moving and kicking at odd angles, and it's bound to kick something out of place and make it just pop out at the most inopportune time at some point or another. And I'm really only ever around, you know, my son, my husband, my mom, and they have all heard me pass gas multiple times, and they're pretty much, well, I'll say my mom and my son are immune to it. I did have a very funny instance the other day, though, where I just about knocked my husband out when I had some really nasty smelling gas, just being real TMI with y'all. And I mean to tell you, this man jumped out of the bed and darted out the door, and it was hilarious, because usually he's the one knocking me over with that. So it was a little nice to have the tables turned. But again, that's coming from a very comfortable place with my husband. Some people are not quite so comfortable, or it happens in a really uncomfortable situation, like, God forbid, you're at your in-laws' house having a nice dinner, or, you know, you're at work, or whatever the case is. And if the lighting is changing, I'm sorry. Like, we went from beautiful sunny day to cloudy, and I don't know what's happening with the weather. So, anyway, it just... that is one thing that can be embarrassing. I know some women find like excess vaginal discharge to be embarrassing. Really, that's, to me, it's a blessing for your sex life, for one thing. You can put the lube away for a while. Don't pretend you don't use it just because you're young. Old people are not the only ones who use that. It's extremely useful. I wish we would have thought of that on our honeymoon/wedding night, but that's a whole other story that I think I should probably have permission from my husband to talk about in the first place. But anyway, that was a wee bit embarrassing for him. But we have interesting times together, he and I. Happens when you've known each other for a decade. But anyway, I don't know why some women find that really embarrassing. Like, they have to wear panty liners, and I've had to do that myself, due to having so much excess vaginal discharge, or another term for it is cervical mucus. And it's extremely common during the final trimester to have a lot of that. Because really, if you think about it, mucus in general is a lining in our bodies. It's like, it's in our nose, our sinuses, back into our throats. It lines our lungs, it lines our stomachs, and it lines our reproductive tract. And what it does is, when there's an irritant, like for example, in a case where you have an upper respiratory infection, or basically a cold, and you're coughing and you cough up mucus, like, it just seems like it's never ending, because your body is recognizing that there's something in your lungs irritating them, or in your nose, in your face, in your sinuses, and those are being irritated, like when you have allergies. And what the mucus is trying to do is coat that area of your body so that it's not so irritated, so that it's more protected from outside invaders. It's the same exact thing with your reproductive tract. So during the final trimester, as your cervix is starting to thin out and open up in preparation for childbirth, that'll start to irritate your cervix, and you'll most likely know when it's happening. You'll probably feel like little twinges of pain in that region, or just a general dull ache down there, and more than likely that's your cervix starting to dilate and efface. And what will usually happen then is, because your cervix is getting irritated, it's going to produce more mucus to try and protect it. And it stands to reason. So it's a natural bodily process, and in my opinion, it's a great bonus for your sex life. I don't find it embarrassing. Oh, this is one that I know a lot of women complain about, and I would personally find it embarrassing. Like, it would take a toll on my self-esteem if I had to go through it. A lot of women get something called melasma, and it's kind of like the dark line that you see down pregnant women's bellies. You've seen it down mine in many a belly shot on these videos. But instead of just on their stomachs, they'll get like patches of dark spots and discoloration all over their face, their neck, their chest. I think it can even travel to other parts of your body, but primarily like your face and everything like that. And I can see where that would be like really hard on your self-esteem. There's not really anything you can do about it. You can't really use bleaching creams. You cannot use anything that has retinol. Really all you can do is cover it with makeup and hope for the best. Hope it doesn't rain. Get some waterproof makeup, some long-wearing makeup or whatever, and try to cover it. But outside of that, it's a hormonal thing. Just like the line down your stomach is due to hormones, it's the same thing with melasma, or it's also known as the mask of pregnancy. And you just kind of have to wait until after delivery for it to go away. There's really not a treatment for it per se, other than delivering your child. Some women get more acne, which I did experience in the beginning part of my pregnancy, but then towards the second trimester on, I haven't really had a whole lot of problem, with the exception of what you're seeing right here around my chin area. And that's only as bad as it is because I keep messing with it and picking at it and doing stuff I'm not supposed to do with pimples. Anyway, some women have the exact opposite, where they, their skin has always been very acne prone, and then all of a sudden it just clears up out of nowhere. And again, hormones, and it totally depends. And more than likely, unfortunately, in that case, your skin will probably return to its former pimply glory after you deliver, because then your hormones will be back to what they used to be. Some people's hormones are just permanently out of whack after they have their first child, or even their second, and some things just change and they stay that way for good. Greasy hair, that's oddly enough a symptom of pregnancy that I didn't really think about, nor do I think I've really had that the first time around, but this time I have definitely had to wash my hair more. My skin has gotten oily faster and easier. Not much you can do about it. I mean, just keep oil blotting sheets for your face, and use a clarifying shampoo. Some people swear by mixing baking soda with their shampoo as like a clarifying agent, and using like apple cider vinegar as a rinse. Whatever floats your boat, whatever works for you. Not so much embarrassing as it is annoying to me, because I'm just used to not really having to do much with my hair because it's always been dry. Like, I would wash it, oil it, wash it, and deep condition it once a week, and I'd be good, and maybe co-wash it once a week. But since I've been pregnant, I've had to do a little more with it this time around. But I think that's predominantly all that I can really think of as far as embarrassing pregnancy symptoms. Unless you want to talk about the kind of fashion that you're probably going to be sporting while you're pregnant. As you can tell, I'm always in pajamas, and frankly, that's because, honestly, that's all I wear now, because that's really all that fits. It's baggy, it's comfy, it's warm, and I'm either usually in pajamas, in my husband's t-shirt and boxers, or just in my room in my birthday suit being comfortable. Because when you're pregnant, really, that's all that you care about. Or let me rephrase that, that's all I care about. Like, unless I'm going somewhere where I really need to look good, I don't care. I'll try to get dressed up for my husband at least once or twice a week, just to look nice and presentable for him. Or if I'm just feeling kind of blah and I want to look back to my old self, I'll try and spruce myself up a little bit. But honestly, I just don't care that much anymore. Right now, I feel big and frumpy, and like my stomach is the Goodyear blimp. And half the time my back hurts, my feet hurt, my neck hurts from being, trying to get myself into a comfortable position all night to sleep. I don't care about the latest fashions. God bless Beyonce and Shakira and Pink and all these other people who look so incredibly put together and fashionable and on trend throughout their pregnancies. But keep in mind that is their job. Like, that's their job to look like that. They have stylists, they have people there, coaching them through it, basically. Because I guarantee you, when you're pregnant, you need to be coached through taking a shower some days. You need to be coached through getting up and getting dressed and leaving your house, let alone walking a red carpet. So, in a way, those women are such great inspirations as to how good a pregnant woman can look. But at the same time, I almost pity them because I know, without a shadow of a doubt, that there's some days when they just don't feel like doing that. Where they just want to lay in bed and eat whatever their pregnant bodies are craving and just either be naked or be in their favorite comfy pajamas and do nothing. But they can't because that's not what they're paid to do. And so, just keep that in mind. If you are pregnant and that's, you're feeling a little bit more on my end of the scale rather than Beyonce's end of the scale, bear in mind she probably feels the same way too, but her job is to look like that. So it's just something to keep in mind. Your fashion will probably take a hit throughout pregnancy, especially if you're thrifty like me and you really don't want to invest in maternity clothes, just because it's like, I'm not going to use these clothes again probably for another 4 years. Why am I going to spend so much money on them? And let me just say, maternity clothes usually are dreadfully expensive. I would rather just buy some baggy sweats and call it a day. But that's just my take on it. If there's any other questions you guys have, please feel free to leave them in the comments. I'm more than happy to answer them. As you can tell, sometimes it takes me a little while, just depending on what's going on. But I will try and address any questions that are posed in the comments. So until next time, you guys, thanks for watching. Glad to have answered your questions. If I left anything out or you can think of any embarrassing pregnancy symptoms, leave them in the comment section below. And I will talk to you guys later. Bye.